right. Well, thank you all. And hello to all of my Florida colleagues. It's quite an honor to be back. I thoroughly enjoy coming down to Florida and interacting with y'all. I know your state is moving and shaking, and I'm really happy to see that things are progressing down there for you guys. Really, it's about time. There's a lot of other states that are moving right now that I'm helping with, and we're starting to hit critical mass. And to the extent that we can get Florida over the finish line next legislative session, man, that's really going to start the ball rolling. There'll be a lot of states that are going to want to emulate. So yeah, I tip my hat to you guys down there. It's going to take a lot of work. It's going to take a lot of grassroots, but you can do it. Now, I've been teaching this course on injectable nutrients now for 37 years, 38 years. Now we just finished up with module 2 in Tulsa here last weekend, and just finished up Alabama here shortly ago. So there is a lot going on right now, and we're real happy to see it. You might notice on this first slide here that we have a tray there. That's called a Mayo's procedure tray. And I want to just give you a little glimpse about some of the equipment and some of the rooms and things that we have in our office. So you can just get a little bit of a feel as to how my particular practice goes and has gone for 40 years. So yeah, this is a Mayo's procedure tray. And you'll notice that we've got some hemostats there, and we've got 3 syringes down on the tray and 1 standing upside down or face down, I guess you could say. This is what we use for intra-articular or peri-articular injections. What you see in these syringes are all natural medicines, a combination of homeopathics, phyto extracts from plants. This is hyaluronic acid. And then over here, that's going to be full of ozone gas. This is collectively called prolozone injection therapy, and it is absolutely killer for degenerative arthritises and chronic pain syndromes associated with any kind of joint, both skeletal and peripheral. So hopefully I can come down and do some training with you all whenever we get to this point, and teach you all how to do this, because it's a staple in my practice on the as far as the musculoskeletal patients are concerned. So just wanted to show that to you. It's pretty interesting. It's on wheels, so we can move it from room to room after we prepare it, and so it's not stationary. Now I'm trying to make this go to the next slide, and I'm not being able to do that. So let me see if I can hit F5 here. And I'm trying to make this go to the next slide, Anaya.
Okay.
Usually I can just arrow over and it'll go, but it's not.
Make sure you click on it.
Okay. There we go. Thank you, Anaya.
No problem.
All right, so now this particular slide is in another treatment room. This device here is an ultraviolet blood irradiation unit. The interesting research was done back in the late 40s, early 50s at facilities in this country, including Hahnemann Hospital in Philadelphia, Scripps, Mayo's, all your top-notch medical centers. This predated antibiotics. They were treating leprosy, bulbar polio, pneumonia, tetanus, and generally 1-2 treatments, and the infectious event was over. Whenever they got penicillin, then what happened was they just kind of pushed these ultraviolet blood irradiation units aside and forgot about them because they couldn't put a patent on them. Now that all these resistant microbes are starting to come back, this device has made quite a resurgence. If we look over here, you can see that we've got medical grade oxygen, and this goes into a medical grade ozone generator, which generates our ozone gas. And so we use both of these to treat a variety of conditions stemming from acute and/or chronic infections, and even our cancer patients get this as supportive care. So let's go to the next slide. This is a pic of kind of our IV preparation area. You'll notice that we have all different kinds of carrier solution bags across here. And then this is where we have all of our add mixtures across here. So we can make these bags up ahead of time, and then the patients will come in, and that's a picture of our infusion suite. Actually, that's an old picture. We've updated that room considerably, but at any rate, that holds about 10 chairs in there, and we'll run a set at 9 o'clock in the morning, and we'll run another set at 2 o'clock in the afternoon. That gives us time to then do all of our consults, our exams, our injections, our joint injections, that sort of thing. Let's see. As you do this work, you will see all kinds of primary care patients, not just musculoskeletal patients. And you get good at it, you'll become a destination practice. This gentleman here was from Las Cruces, New Mexico. These folks here are from Georgia, this guy was from Georgia. These two individuals are from Arkansas, and so forth and so on. I mean, you become a destination practice because this stuff works. See, people want biocompatible natural medicine instead of the hardcore allopathic drugs. And that's what this is. It provides a service that is compatible with their system. And my God, 80 to 90% of the, I'll say 90% of the time, we actually have an equal to or better answer on the natural medicine side of the fence. That's another picture of the preparation area that where we prepare our IVs. So anyhow, just to kind of get into a little history and how we arrived at doing this here in Oklahoma, passing the legislation all the way back in 1981. We've been doing this work now for 42 years. Can you believe that? I mean, it's just amazing. But people forget that D.D. Palmer, the father of our discipline, he said that as soon as the human mind is capable of absorbing a still more refined and advanced method, and human inspiration demands it, it'll be delivered to the denizens of the earth. And they forget that, he opened up 2 major schools. He obviously had Davenport, but sometimes folks don't know about the fact that he opened up D.D. Palmer of the College of Chiropractic in Portland, Oregon, which is now Western States. And in fact, he whenever he opened up that particular college, it was fairly innovative among chiropractic institutions at the time. And it proposed an 18-month curriculum extending over 2 years to include dissection, minor surgery, and obstetrics. And he said he wanted to train and educate chiropractors to a level whereby a chiropractor should be able to care for any condition which may arise in the families under his care, the same as an allopathic physician. So, clearly he wanted to get the skills to get us to a point where we would have the skills necessary to treat all family members with any kind of conditions that we would be presented with. So then I also trained the doctors in New Mexico for their advanced practice rights. They have, some prescriptive authority rights out there, as well as injection rights and all that. And so they're called advanced practice chiropractic physicians out there. Interestingly enough, a young lady who was going to Palmer contacted me and said that she was interested in interviewing me because she wanted to know more about injectable nutrients. Injectable nutrients is kind of a first step hurdle, and it's a very logical hurdle for chiropractic medicine because, again, it's all biologically compatible. Her name was Christina Hall, and she was the news editor at the Palmer Beacon, for those of you who might have gone to Palmer. So I'm going to share some stuff here with you. Let me see if I can find. Here's her question. She says, "Why, as chiropractors, are we including injectable nutrients in our scope of practice?" And basically I said, look, we have the opportunity to treat not only musculoskeletal practices, but a whole variety of primary care conditions, including but not limited to chronic fatigue, fatty liver congestion, adult onset asthma, coronary peripheral vascular diseases. I've got 2 of those right now that we're dealing with. Crohn's colitis, multiple sclerosis, lupus, on and on. I mean, we treat a tremendous amount of co-treatment with a lot of cancer patients. Here's one thing to consider as far as the IV therapies are concerned, which are just phenomenal, I might add. But, most of the American population, or a large percentage of them, have compromised GI tracts, and running from dysbiosis to hypochlorhydria to endogenous enzyme deficiency, leaky gut, and other GI maladies. So they can't really absorb adequate amounts of critical nutrients, even if we're giving them target specific nutrients to try to help treat, some ailment. So consequently, sometimes we have to give larger boluses and bypass the gut, the malabsorptive gut problem, so that we can affect repair in the body. And so we do that with a lot of different kinds of nutritional injectable agents. I mentioned here magnesium sulfate, folic acid, multitrace elements 5. Remember, it's the trace elements that run and repair all the enzyme systems in the body. So, if they've got a compromised gut and they've let it go on for a long time, you're not going to be able to get from point A to point B just with oral nutritional meds. So let's go to the next slide here. So she asked the question then, she says, well, what are injectable vitamins? And I kind of said that they ran the gamut from methylcobalamin, which was a form of B12 used in patients with methylation pathway defects like autistic kids all have, to individuals with increased cardiovascular risks due to elevated homocysteine. If you haven't heard about homocysteine, you might want to run it on yourself because it's a player. There's 150,000 deaths a year in the United States just due to high homocysteine levels alone, regardless of whether or not your cholesterol or anything, or your inflammation markers are off. It's a nasty thing. And the methylated B vitamins, B12, B6, folic acid, bring those down. I said also from 8.4% free amino acids needed for those patients who've been taking long-term acid blocking drugs. Now, those everybody on here probably understands that those acid blocking drugs are only supposed to be prescribed for 14 days. You know, what happens is they're on them for decades. And then they wonder why they're not digesting their protein and their minerals to do repair work, and their whole body falls apart. And now we have to play catch up ball to try to repair the gut and then also get the nutrients in there so that we save their lives, essentially. So there's a lot to our capacity to be able to help folks in the natural realm. And it's something that if I had to go without being able to practice this style of medicine, I'd probably just say, well, I'm done and retire. So I also mentioned down here compounded agents such as colchicine. That's an extract of the autumn crocus plant. And whenever applied intravenously, we can take a person who is in severe antalgia with a lumbar disc rupture, and within a couple of treatments, boom, they're completely straight. It's some of the most powerful natural medicine to take that swelling and consequently that inflammation and pain down that I've ever seen. And it's all natural. That's just amazing. And then I said to reduce glutathione, which we use for a variety of reasons. It's the most potent free radical scavenger and detoxifier that the body makes. Okay, so let's see what the next slide has. Okay, so yeah, this just kind of talks about what's happened in the past. You'll notice that I've got that we've had this authority in Oklahoma since 1981. New Mexico, Idaho has complete authority. Utah for homeopathic agents. You know, it looks like several other states are coming online, so including Florida, hopefully as early as next year. So I'm really excited to come down here, come down to Florida and start training y'all again. So let's see what I've got here. All right, yes, I want to mention this. There is a nutrient gradient that exists. This involves the IV work, okay? There is a nutrient gradient that exists between the extracellular and intracellular compartment. And sometimes, as I previously stated, those oral nutritional medicine protocols may not be concentrated enough or fast enough to get the job done. And that's where these parenteral protocols come in. Yeah, I threw in an example here. You know, consider a young child who, you know, they're positive for influenza A. They've been vomiting their guts out and have diarrhea that's just persistent. They've run this high fever for a couple of days. Obviously, as chiropractic physicians, we're going to adjust that child. But is that going to get them over their critical dehydration and nutrient depletion? And the answer is no. I mean, that's an emergency deal. So, but whenever we use intravenous lactated ringers, potassium chloride, mag sulfate, and especially vitamin C, we can help that child get back rapidly to recovery. Remember that this is amazing. I love vitamin C in injection and also IVs because it does so many profound things to our immune system. If you'll look at this, vitamin C does 5 things. I always put it on my tests or exams that I give doctors who go through the training. It increases immunoglobulins. It increases all the complement factors. It increases the endogenous production of interferon. It increases the endogenous production of hydrogen peroxide, which is your very first immune system warhead that you have. It's amazing. And then it also increases macrophage activity. That's your Pac-Man on speed that goes out and eats bad guys. Lowly vitamin C in high concentrations intravenously does all of that. Back during COVID, I was doing 7 days a week for months, and we saved, well, we saved everybody. We did not lose one patient. And that was, I hope I never have to go through that again. But anyhow, that just illustrates what can be done and accomplished kind of on the IV side of the fence. I also, for the musculoskeletal disease, I've included an example in here about persistent trigger points. You know, that we have all of our favorite manual therapy and different treatments for trigger points. Generally injecting B12, maybe a little mag chloride, and maybe a homeopathic such as Traumeel and Spascupril into a trigger point in a retrograde injection manner in at least 3 quadrants, it'll break that trigger point like that, and it'll stay broken. It's absolutely amazing, and it's all natural. Now, it's technique driven. So what we do is we inject on the way out on the core, then we redirect without pulling the needle out, and we inject on the way out, so we cononize that trigger point, and it takes it right down. It's unbelievable. Another example that I had was that should be 25% dextrose to pepper a ligament attachment that's torn or sprained. And what that does is it creates an osteoblastic reaction. So it tightens that ligament and that tendon back down that's been torn. It's called prolotherapy. Perhaps you all have heard of that. And again, you're using all natural medicine substances. There's hundreds of these protocols that we've developed through the years. And it's just amazing, both on the musculoskeletal side as well as more globally, the primary care side, that we can do to help these folks with these natural medicines. I wanted to mention just a couple of more things here. You know, we look at our allopathic colleagues, and we look at all the polypharmacy that is done, that's prescribed on a routine basis. I mean, you all know what I'm talking about. You've got patients coming in that are on 6, 10, 14 different medications. And, you know, you got to ask yourself a question. Who is it? What discipline is it that's going to address that and solve that problem and offer those savvy healthcare consumers the natural medicine options that they're looking for so that they can remain healthy, okay, and or get over their critical illness or musculoskeletal problem? Who's that going to be? Well, it's going to be us. And we're going to accomplish it by doing the training in all these parenteral natural medicine injections. You know, here in Oklahoma, we've had that authority since 1981, and we've rendered well in excess of 1.5 million IVs, probably close to 5 million injections. I mean, I've done over 250,000 IVs myself. So it's a therapy, or a type of a category of therapy that we need to hitch our wagon to, and we need to just go for it. And I am so happy to see that Florida is going for it. I tip my hat to you guys. I'm there for you. I'll help any way that Rod and the association wants me to. But I'm just so happy that you're taking this next step. So anyhow, Anaya, I think I'll take some questions if you want me to.
I have a question from Dr. Kahar. How long will certification take?
Well, that's going to be up to the individual state. Most states are requiring a minimum of 24 to 36 hours. And there may be more hours than that. Now, typically what we do is we will put the training on over a weekend. And so we'll do however many weekends it takes to accomplish the number of hours needed to satisfy whatever the state board requires. But at any rate, that training involves didactic lecture, and it also involves a lot of hands-on as well. So, but that's a state thing. So each individual state has to make up their mind how many hours. We're waiting on more to offer a question. I'm going to make another comment. You know, we've talked about primary care related conditions, and I've also talked about musculoskeletal conditions. I want to make one quick mention, as I did this past weekend here in Oklahoma, about the aesthetic medicine options too with these natural medicine agents. You know, a lot of females are now becoming savvy enough to where they've seen the research that Botox has been found in some of these Alzheimer's lesions. And so now they're looking for natural medicine ways to rejuvenate the face and cause the wrinkles to soften and that sort of thing. These natural medicine agents are amazing, including some of the guna homeopathic agents, as well as some of the heal homeopathic agents. But whenever I just very quickly mentioned that, there were a lot of women in the course over the last weekend whose ears perked up and asked a whole lot more questions about that.
Okay, well, we have a question from Dr. Romanov. You can unmute yourself and hopefully we can hear you.
Yes. Hi, I have a question. I'm a chiropractor. Are we allowed to do injections in the state of Florida or not yet?
Well, that's the answer to that is not yet. But pretty soon, you know, we're going to come down and start doing some training, and the FCPA is working very, very hard right now to lay all the foundation so that the grassroots, the lobbying, the verbiage contained within the bill that'll be introduced, I mean, that takes a lot of effort, a lot of planning, a lot of time, and they're doing a stellar job right now. And so hopefully next legislative session, we'll be able to get that over the finish line, and then you'll have that authority at that point.
So when is the next legislative session?
That'll be, as far as I know, because I'm in Oklahoma, as far as I know, that's early next year.
Okay, so we have some time. Okay, thank you.
You bet.
Okay, I have a question from Dr. Klurch. How much for the kids you showed, and what's the average price for the service?
Oh, I love that, doctor. I love that question.
I also have another question, kind of on the cost, is asking what is the cost of getting the office set up to provide injectable nutrients? So kind of related. Yes,
indeed. A lot, the IV bags that you saw back at the beginning of the presentation, it depends upon what's placed in those for the specific reason or condition that patient needs. So you may have anywhere from $10 to $15 in a bag to as much as $30 or $40 into a bag or more. And then those charges are going to be anywhere from 140 on up to 240 and higher, depending upon what is used. And that's on the IV side of the fence. Whenever you get into some more of the sophisticated IVs, like the major autohemo ozone coupled with the ultraviolet blood irradiation, that gets a little more pricey as well. Now, for just regular IM shots, you might have just a few dollars in that, and the charge will probably be in the range of $30, $35, $40, something like that. For the spine related injections and or the intra-articular injections, those if you're going to do prolozone on those, the charge will be no less than 250. It could be as high as 450 per joint. So it's and again, that's all cash. We do not bill insurance. I've never billed insurance. That's an all cash proposition. Now, if you get this through and you're working on motor vehicle accident patients, I'm sure that you could bill insurance and get reimbursement. But standard regular insurance, I'm sure it would take some time for them to finally realize and acknowledge the fact that that's a reimbursable service by a chiropractic physician. I just got tired of fighting the battle, so I went cash, and it's worked out really well for me.
Okay, I have a question.
Yeah.
Will injectable nutrition allow you to perform PRP?
Excellent question. PRP is not it's not a readily recognized nutritional item. Although platelets are made up of a lot of nutrient composition. So there's going to have to be an interpretation there, which, we're actually going through in Oklahoma right now. We had that authority for a long time. And then the Board of Examiners, unfortunately, there was several members on that board that would like to practice chiropractic as it was in 1895. And so now there's some questions about that we're having to jump some hoops. But in the long run, I think that we will probably prevail because, those platelets are made up of nutrients. So anyhow, that's kind of a roundabout way to answer your question. It might not be self-evident right out of the blocks, but I think eventually it would become self-evident.
Okay, I have missed a question from earlier from Dr. Kwan. It's the training available only after legislation has passed, I guess.
That's a good question. A lot of states that are pursuing this, they want to implement training before the legislative session so that the chiropractic physicians, number one, have some skin in the game so that they can go out and do their grassroots lobbying. But then number two, it allows them to be ahead of the game once that bill is passed and signed into law. So, they're ready to roll at that point in time. So, yeah, most of the states look at maybe providing the educational component at least a little bit before they run their bill. It helps with the enthusiasm. It helps with the support. It really helps, and it gets the doctor excited, and then they're ready to roll the second that bill gets signed into law.
Okay. Does the training have to be done in person?
Yes, it does. It has to be done in person because there's just no other way to train on injecting joints, injecting trigger points, injecting or starting IVs. I mean, there's a lot to that, but trust me, if I can learn that, anybody can learn it. So it's not that difficult, but you want to make sure that you learn it properly and perform it properly so that there's no problems and you'll get maximum clinical benefit for your patients.
Will our malpractice insurance go up a lot?
Okay, the answer is no. It will probably go up just a little bit because this is new. And there are other states, but those other states, they have seen minimal increase. So, I mean, you have to look at, claims that have been made, and there's just very, very few. I mean, you look at the fact that Oklahoma has done, millions of injections, probably close to 2 million IVs, and there's no dead bodies. The malpractice insurance carriers go, well, if we compare that with our medical colleagues, we're running a pretty good track record here. So it might go up a little bit, but it shouldn't go up much.
Dr. Jeff is asking, what about peptides and exosomes? Would that be included under injectable nutrition?
Yeah, peptides would definitely be included because what is a peptide? Oh, it's protein. It's several amino acids put together, and that's a nutrient. And as a matter of fact, you can buy some of these peptides off of the nutritional supplement counter at your nutritional supplement store. So anything that is anything that's a nutrient that you can purchase in a health food store, if you can get it compounded by a compounding pharmacy for injection, that would qualify as an injectable nutrient.
All right, Dr. Rose, is a crash card needed, and what percent use have you experienced?
Yeah, that's an excellent question. So yes, you do need to have epinephrine. You do need to have Benadryl. You do need to have 50% dextrose, which is sugar. And you do need to have oxygen. Now, what will happen is it's always your alpha male who will just boom, crash whenever you're giving them a shot. And that's vasovagal reactions. That's syncope. In other words, that's simple faint. And, you just put some smelling salts under their nose and lay them down, and they'll eventually wake back up. But, anaphylactic shock is kind of the angle I'm sure that he was asking the question from. And of course, you got to have some tools to be able to handle that. Including 1 to 1,000 aqueous epinephrine. And of course, that would be written in to the law. But at any rate, yes, you need to have some emergency things. And of course, that is covered in the training. I just covered that this past weekend here in Oklahoma. So with the new doctors who were seeking this credential. So excellent question.
How often have you experienced the need for emergency situations?
That would be one time. One time we had to intervene, and of course, doing over 250,000 IVs, you would probably think that it would be more often than that. Well, certainly if you were using allopathic drugs, but on the nutraceuticals, no, it's just exceedingly rare. One time in my office.
I have a question regarding continuing education. So will there be a need for continuing education hours once you trained, once you get your certification? Is there a continuing education?
Yeah, that's an excellent question as well. And the answer is yes. Probably every 3 years or so, probably need to have at least 6 to 8 hours of CE. There's not that much that changes, but it's just wise to go back and review and basically stay sharp.
Okay, will that, so you're saying 3 years, but if Florida keeps its biennium, it would be more to go with the other education, with the others.
That's fine.
Okay, all right, I have more questions. What is the extent of training available for intra-articular injection proficiency?
What is the, one more time, and I didn't get that.
Sorry, what is the extent of training available for intra-articular injection proficiency?
Yes, okay. Yeah, that's in the coursework. That's all hands-on. It's all hands-on. And in medical school, it's show me one, then you do one, and then you teach one. That's kind of the way it is whenever these guys go through residency. It's no different here. We have to, it's a hands-on, get dirty kind of thing. I mean, you've got to be able to experience it, do it, and own it.
I don't know if you have a closing statement.
Well, I really enjoy coming down to Florida and breaking bread with everybody, and I just love the state, and I just am so proud of what what Dr. Lacey and the FCPA has been able to do down there. You guys are awesome. I wish you all the best going forward, and if there's anything that I can do to help in that process as you all are going forward, just, you got my number. Give me a call.